Hello, everybody. It is my pleasure to welcome you in this Ask the Author session. Today, we'll talk about hepatocellular carcinoma and treatment in second line. I have the pleasure to host today Dr. Pascuale Lombardi. He's a medical oncologist. He trained in Italy and now is doing his PhD in UK in Imperial College. We'll talk today about a paper entitled Lenvatinib versus Sorafenib as second-line treatment post-Atezolizumab and Bevacizumab for hepatocellular carcinoma, the LEVIATHAN study. So as you know, now we have first-line treatment, which is immuno-oncology, and as a second-line treatment after immuno-oncology is quite open. We don't know now what is the best treatment. And so this study is trying to answer this. And so thank you very much, Dr. Lombardi, to be with us today. So congratulations to you, to your co-authors for this very important study. Can you tell us what is the design of this trial?
Sure. Thank you. And thank you for the invitation and for having me. So the Leviathan studies, the Leviathan study originated from a prospectively maintained international registry, including the more than 1,000 patients treated in clinical practice with Atezolizumab plus Bevacizumab across 26 centers worldwide, including Europe, US, and Asia. And within this framework, we designed the Leviathan as an observational cohort study, especially aimed to answer a single question: what is the optimal second-line therapy after progression on Atezolizumab plus Bevacizumab between Lenvatinib or Sorafenib? So this was not a randomized trial, of course, but we applied propensity score matching to try to minimize the imbalance between the two group of patients, and we use factors such as the ECOG or the ALB grade or the alpha-fetoprotein levels, and most important, the response to the immunotherapy as to try to compose our propensity score matching.
So what are the most important results of this study?
In my point of view, the most important results are the survival outcome that we observed in our study. From the progression-free survival point of view, we had 5.5 months in the Lenvatinib group and 2.6 months in the Sorafenib group, and the median overall survival was 11.9 months versus 7.4 months, respectively. And this difference remained statistically significant even after the propensity score matching. But another key finding is that Lenvatinib remained active even in patients that were primarily resistant to the immunotherapy, so those who never responded to Atezolizumab plus Bevacizumab. And this disease, in this particular subgroup of patients, the disease control rate was around 58% in the Lenvatinib group and 29% for the Sorafenib group. Those are, I think, the most important finding of our work.
It's very relevant and is also in line with other studies showing that actually Lenvatinib is superior to Sorafenib. But now we have your data. I think it's probably the best we'll get, because I don't think we'll never get a phase 3 randomized clinical trial on this. But do you think this is enough now information to actually use this information in our clinical practice?
Well, I think so, because from a clinical point of view, this study has a strong practical information, because Leviathan provides probably one of the most, but probably the most comprehensive real-world evidence comparing these two particular TKI. And the key message is that TKI are not interchangeable in the post-immunotherapy setting. And based on our results, Lenvatinib should probably be considered as the preferred second-line option after Atezolizumab plus Bevacizumab over Sorafenib, given its superiority in terms of efficacy or control rate. Of course, we are still awaiting some data from the prospective randomized trial that should guide us in the second-line treatment for this patient. But until those data are available, LEVIATHAN offers a solid and clinically meaningful rationale to guide our sequence in the clinical day practice.
Yes. And there's a reason we selected your paper, because it's very important. And you highlight very well the points. So thank you very much for doing this. And thanks everybody for listening.
Thank you. Thank you very much for having me.
Be part of the future and join our fight against liver cancer.